Hi everyone, I'm Melissa. I'm a nurse injector, and the first thing I'm going to do with our model today, if you look, this side of the lip is bigger, more full than this side. We call that asymmetric, and I'm going to go ahead and start off making her lips symmetrical, meaning to get them both the same on each side. So what I'm going to do is I'm going to take this blue pen and I'm going to outline it to make it where it matches the other side. And that will give me a marker to know exactly how full I need to make it, because once you start injecting, the lips start to swell and you can't tell if you've actually accomplished your goal of making them symmetrical or not. So this will give us a little bit of help in that. For a minute. I've chosen for this model Restylane Define. So I also want to let you know, before you come in, maybe 3 to 4 days, if you're taking aspirin, fish oil, all those things can cause bruising. And it doesn't cause the bruise. Actually, me doing the injection starts that process, but your blood doesn't clot up, so it just continues to bleed when you're using something like those are blood thinners. So it's going to more likely cause a bruise. And that also can make that bruise last longer too. She's doing really well. So I'm gonna start working on the bottom lower lips. So would you go ahead and slightly open your mouth? Thank you. What I'm doing right now is just going along where you would do like a liner, a lip liner, like I did up top, just kind of outlining the lips. She has a great set of lips, just needed a little tweaking. No one's perfect, no one's exactly the same on each side. Some people you can tell less than others. Yeah. It's a little more painful on her bottom lip, seems to be.
Do you like to typically start with vermilion border?
I do. Well, I actually start where the deficit is more, and then work that out, because you want to see how much product you're going to have left, and then you work with it from there. But right now, her bottom lip was already pretty full, so I'm right now just gonna kind of enhance it a little bit. You always want your bottom lip bigger than your top lips. That's just Aesthetics 101. Bottom lip always needs to be bigger than the top lip. And if you need a break, you let me know, because I'm all about comfort here. You doing okay?
Mm-hmm.
All right. We're almost done with this part. Yes, dear.
So another important thing is not to over volumize the outside portions of the lip. In other words, where the commissures are.
Yeah. You
That
kind of want to
looks
stop
abnormal. Yes.
at a certain point.
Kind of concentrate on the central 2/3
Right.
the most.
And I think they would call that the Joker look if you...
Enlarge it all the way across.
Yes. We don't want to do that. So now this is the pillow part. I'm going to make a pillowy puff, kind of a pouty mouth is what they call it. Almost done here. Go ahead and put your lips together normally. Just got a little bit of blood. Let me just apply some pressure there. Wow, that's looking great. Okay, so I'm gonna go ahead and have the model look at her lips. I'm not done at this point. We're just looking to see about the symmetry, see if she notices anything. I'm still noticing a little bit through here needing to be filled out, but I just wanted her to get a little bit of a glimpse of what we're doing. And then we'll start, that was just, like I said, 1/10 of a cc, and it's already made a major difference.
Wow.
So we're gonna continue on. Enjoy being here and watching this, because I hope to see you soon to help your lips achieve the best look they can. So open up a little slightly. Okay, I'm gonna go right here. And that helped. Go ahead and slightly close. Yeah, that's looking good. So right here, I'm gonna give her a little bit in the middle.
Looks like she's been real comfortable.
Mm-hmm.
I
haven't felt anything hardly.
Really?
Mm-hmm.
Well, some of the people out there, you might not experience it not hurting as much, but I will tell you, we did use, and I will always use, unless you just don't want me to use, a lidocaine cream on the lips. So that will help with comfort. It'll also help with maybe a little inflammation, and mainly comfort though for our patients. And Dr. Burroughs likes to use that a lot too.
And we find the lidocaine tetracaine mixture
Might hurt a little bit.
ointment is really great for taking out any discomfort with this.
Did you see how that perked up? Look at this side. Now look at this side. Just one little bit, a smidge, helps that. Right there, look at that. This is really an art, and I love doing what I do. You can tell most of my patients come in saying, I really feel comfortable with you. You really enjoy what you're doing, and I do. Okay, I'm gonna do this side to kind of even it out. Little pinch. There we go. We're gonna make that just perk up those beautiful lips. She already had beautiful lips. She really just wants them to be more symmetrical and plump. A little blood, not much, just a little bit. Okay. Go right in here. This is really the most tender area. And I like to kind of just shape it to where I want this product to be. You know, I've watched on some of the nurses' websites and even some YouTube videos that I've seen put out there where they're putting 3 syringes in people's lips, and I just don't even understand it. We are at 0.8 of a cc, and I've already achieved this with this model. To put 3 of these syringes in her lips would be a duck lip, and that's non-attractive to anyone. Go ahead and close your mouth. Okay. Going in the wet dry border right here. That will turn that lip out a little bit, or up. This does not make your lips stiff. If you can see, her lips are very soft. This is a great product to use in the lips. Okay, I'm gonna start working on the bottom, and this right here along this rim, I wanna show you. That's a little bruise starting to form. You can get bruises on your lips. There's, you know, we treat bruises for free, but not on the lips. You cannot do an IPL on your lips. So when you do come in, just know that it can cause bruising, and that should go away probably, depending on the bruise and how much you bruise, within 3 to 5 days. Ice will help, but also lipstick if you need to hide it. Do you want to give her a second? So one of the things that we also look at is, this model doesn't have it, but some people have that downward smile where, yeah, right there, she demonstrated it perfectly. Even at being relaxed, kind of looks like they're frowning. This technique that I'm going to show you, if you put it right here like a little V in the corners of the mouth, a little there, and a little here, it can turn that into a smile look instead of a frown.
But very natural looking.
Yeah, just very subtle.
You can already see that
Yeah,
happening.
look
there.
at this side to this side.
Just a very nice subtle. The other thing, comment on helping them get that look with botulinum.
Here,
About 1 centimeter out and 1.5 centimeters down.
okay, about 1 centimeter out and 1.5 centimeters down, right about here, and it relaxes that muscle. When it relaxes it, you would think it would pull down, but it doesn't. It actually pulls that muscle up. So,
Gently.
very gently. Lightly open your mouth. Thank you. So you notice that this model is bleeding. I did ask her prior to the procedure if she's taken anything like ibuprofen, anything like that. She has taken some Aleve in the last few days for a headache. And so that is the reason she's bleeding more, and potentially, as you can see, some of that darkening will probably be bruising.
But it'll be okay.
It will be okay.
And lipstick covers it very,
It does.
very well.
Let me get this bleeding under control a little bit and we'll move on to the next part.
And if the bleeding extends outside the red area of the lip, you can use the intense pulse light, which will make it go away very quickly.
And that would be down in this area, but not actually on the lips. And that can happen where the bruising extends out into the facial area around the lips. And we can treat that, as he said, but we cannot treat the actual lip itself. Okay, go ahead and close slightly.
I would also add an experienced injector will be able to tell swelling from the filler product under most circumstances, so that you don't underfill or overfill one area compared to the other, because they can feel a bit different, the filler versus some swelling. Go ahead and close your lips. Wow.
Look at that. I'm going to give her a second to look. Wow.
One thing I'll also add, lips can take time, and your injector should take time, because it's very notable area once it's injected, so you want it right.
I'm done with the bottom.
Besides the topical anesthetic, injecting slowly helps, and you can also do some distraction by tapping the skin near the area you're injecting, and that helps confuse the nerves and take out some of that discomfort. Injecting slowly is also safer. And provides a more precise injection.
Another thing to also be aware of is when you get your lips enhanced, they're more likely going to chap because now there's volume in there. So use a really good lip chapstick. We have SkinCeuticals has a really good lip balm. We also have Elastin, Nectar, or balm, and that would really help too. So I'm going to go ahead right in here in the vermilion column, and actually in the columns, and I'm just going to show you right here. I'm just going to put a little product right there. This can be a little tender, so we'll have the model take a deep breath in. So this is called Elastin Enhance. It's post-injection serum, and I'm placing that on the model's lips. Got a little blood right there. Elastin carries really good products, especially post-procedural healing, and then they also have products that will continue the healing process after. You don't need to use like Nectar. Nectar is something that we use after someone's had CO2 laser or any type of injury to the face. And
It
then
can also be used beforehand because it boosts the arnica levels in the skin
Very
up to
true.
50 times.
Okay, go ahead and close your lips. Just want you guys to get that finished look of this model's lips. And we'll do a before and after picture. Thank you guys. Stay safe and have a great day. We just finished the model's lips. One of the things that was important is when she called to make her appointment, she did tell us that she was prone to fever blisters, and that was really good of her to tell us that because doing lip filler can also aggravate or promote a fever blister if you are prone to those. And if you are prone to fever blisters and we're going to be doing injections in your lips or around your lips or any type of procedure that like CO2 around your lips, we can call in a preventative medicine to start that before you get that done prior to the injection, and then that will help not bring on that cold sore. One other product that I wanted to share, and we don't sell this, but I just picked this up at Walgreens. It is Arnica Cream, and that is something post-procedure. You can also use it before the procedure. There's also Arnica pills. So we have a line that we use at our practice more, and it is the Elastin line, and it's the Nectar. So if you use that a few days, even a week before your injections, and just apply it on your lips or any area that you're going to have CO2 done or any type of injections, it has a arnica in it, so it's going to help with bruising and help not bruise potentially at all. And if it did bruise, it's going to make it a lot less than what it would have without using it. And just wanting to kind of see what you want to achieve, the look that you want. If it's just you want symmetry, you know, being equal on each side. If you have a scar, we can actually work with people that have scars on their lips from maybe they had a dog bite when they were younger. Filler really helps to conceal that and to even out that in the skin. We can do that with your cheeks. Also, a lot of people have, you know, the nasolabial area where it's starting to droop. If we put filler in the cheeks, sometimes that'll also help, because everything as we get older starts to come down. So filler can be used in a lot of areas of the face. I love using it. It makes a big difference. I can't do surgery. I'm not a doctor. I'm not a surgeon. Dr. Burroughs can do surgery. A lot of people do need that. But it really just helps to enhance and to help with fine lines, wrinkles, and even deep lines. So we'll see you at Springs Aesthetics.
Here you can see her before picture and notable asymmetry. And here's her post picture with improved symmetry. Here's the sagittal view. And now the post-injection view with nice enhancement.